Hello, Dr. James Bogish, expert in health and longevity, and today we're going to talk about lipids, things like cholesterol, triglycerides, VLDL, LDL, and most people are aware of total cholesterol and LDL, maybe HDL, rarely VLDL, rarely triglycerides. There are some other markers that are things like apolipoprotein B and another one called lipoprotein little a. Those last two are not typically checked on an average panel when a doctor runs a lipid panel. And yet, they've been shown to be pretty strongly linked to cardiovascular disease. As a matter of fact, this particular study looks at people's residual risk in what we've always considered like the normal range, and it found that people even the normal range had a pretty significantly increased risk of having what's called MACE, major advanced coronary or adverse coronary events, things like heart attack, heart failure, all those things that we don't want to happen to our cardiovascular system. And when you read through the article and you're going to find that there's really not any way to change lipoprotein little a, so we haven't typically recommended checking it. Well, now that we have some drugs in the pipeline, and even one like Repatha, which is a PCSK9 inhibitor, all of a sudden maybe we should be checking this because we now have a drug to check it and nothing else works, which completely flies in the face of a very large body of research on natural ways to lower lipoprotein little a. So flaxseed has a pretty long, so the alpha-linoleic acid, the ALA, the omega-3 found in plants, so think flaxseed, think nuts, have been shown to not only protect the heart and lower the risk of MACE, probably through lowering lipoprotein little a, but a lot of other factors as well. And things like pectin, increasing carbs will raise, so lowering carbs will lower lipoprotein little a. For these articles to all suggest that there's no way to lower it, and so we shouldn't check it, just is not true. Personally, I rarely check outside of the normal lipid panel because I feel that 99.9% of the problems you're going to catch in a typical lipid panel when I look at things like triglycerides, VLDL, and HDL. Not that impressed with total cholesterol or LDL. I really like to look at some of the other markers. But it's just another way. I've always said that cardiovascular disease is almost entirely preventable. And even in those rare instances where somebody, like, gosh, their cholesterol was okay, maybe if we look at their ApoB or lipoprotein little a, we might find that those things are off. But it all boils back down to lifestyle. We need to be living a heart-healthy, anti-diabetic lifestyle to have the most bang for your buck. And that's where we see the most power. There's the mainstream, what I always say is if these medications that we use or procedures or interventional were so fantastic, cardiovascular disease would not remain the number one killer in developed nations. There's no other way to say it. We suck at treating cardiovascular disease. We suck acute. Maybe if you're in the middle of a heart attack, we're pretty darn good at that. If you want to prevent the first one or prevent the second one, we suck. They're very drug dependent, and the story of lipoprotein little a just exemplifies that, where they're like, hey, we shouldn't check it because we don't have any drugs that lower it. As soon as we start seeing drugs that lower it, you'll start seeing these press headlines that, oh my gosh, we need to check everybody's lipoprotein little a because if it's low or if it's high, we can now give them a drug and it'll fix the problem. When maybe we should have been talking about the fact that flaxseed has been shown to lower it in meta-analysis and lower the risk of heart disease and heart attacks and MACE. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.